everybody. Welcome back. Thanks so much for being here with me today. I'll wait just a moment for a few of you to arrive and I will tell you who I am while we're waiting for that. My name is Maureen, or Nurse Mo if you've met me before through my website, Straight A Nursing, my Facebook group, Thriving Nursing Students, or my podcast, the Straight A Nursing Podcast. So hello, Estella. And I see somebody else is here as well. Hello, whoever that is. So I want to talk today about some personality traits of successful nursing students that I've seen over the years of mentoring a ton of nursing students. And what I've noticed is that the ones who are successful tend to have, one or more of these traits in common. So my goal with you here today, if you're starting nursing school soon and you're asking yourself, do I have what it takes? I want you to recognize in this list some things about yourself so that you can go into this knowing that you're made of the right stuff and that you can do this, okay? So there's 12 things I'm gonna go through. Are we ready? And I'll list them out in the comments afterwards, so don't feel like you have to take notes. But I have notes that I'm going to be looking at, okay? So the very first one, and this is probably the most important one, you guys, is a trait of resourcefulness, of being resourceful. And what I mean by that, okay, let me give you an example. Let's say your instructor gives you a homework assignment and says, I want you to make a PowerPoint and include audio and upload it to the Canvas or Blackboard or whatever as an assignment for your, to teach a topic to the rest of the class. Okay, fine. But you can't figure out how to do the recording component of that assignment. So resourcefulness would be looking it up and figuring it out and moving on with your life, right? Maybe playing around with the program until you figure it out. For some people, that might be the fastest way. For most people, still resourceful, but it's going to take a little bit of more time. So maybe not the best time management, but then some students will just skip all that and email the instructor to ask for help. And then they have to wait for the instructor to look at their email, open the email, respond to the email, even know the answer to the question. And then still even other students will just ignore that part of the assignment, turn it in and say, I couldn't figure it out. So resourcefulness means kind of picking yourself up by your own bootstraps, figuring things out. Nurses always have to be figuring things out. If you guys haven't started clinical yet, you're gonna see so much ingenuity and invention with the nurses. I mean, if something doesn't work, we figure out a way to work around it or make it work. Very, very resourceful. Okay, so I would say that's a great trait for nursing school, a fantastic trait for working in the hospital. Another example would be one time a student emailed me to ask me what an elixir was. So I don't know if they were doing homework or what, but they wanted to know what an elixir was. And I'm happy to, help people. But how many hours went by before I saw that email and was able to respond. It would have been a lot more resourceful of this individual to just go look that up, just go and kind of take charge of the learning. That's resourcefulness, okay, you guys? So think about a time when you've been really resourceful, and then I want you to translate that when you're at school and maybe you hit a little bit of a roadblock, feel like, okay, I can handle this. Okay, so that's one. The second is curiosity. If you're the type of person who's always asking why, like if that's the word, the question word you use the most, why, you're probably going to do really well as a nursing student. Lots of, why does this work? Why does the body do that? Why does the patient respond when I do this? Why does that drug act that way? If you're asking why and have a general curiosity, a general interest in the answer, then you're really going to enjoy nursing school because you're going to get to ask why all the time and find the answer to that question a lot. Having that curiosity, asking why, is going to help you understand concepts and not just memorize things. And understanding concepts is vastly more important than memorizing a bunch of facts, okay? So that's number 2. Number 3 is self-awareness and situational awareness. So what do I mean by that? Self-awareness is an ability to objectively analyze your own behavior, okay? I've got notes, that's why I'm looking down, you guys. For example, what's a good example? Like a lot of professionalism, professional behavior comes about because the people that exhibit that behavior have self-awareness of how they come across, right? So being professional, presenting yourself well, all of those things are part of self-awareness. Now, situational awareness is something that's really going to come into play when you are in clinicals and when you are in sim lab. And you guys, I have kind of a fun example of this. So I have a friend who is very particular about everything. And one time, years and years ago, I don't know what we were doing. I think we were going over there to pick her up for lunch or to go out for dinner or what have you. And she was upstairs. And so my friend and I thought it would be really funny to move around the photos on her mantle, you know, just a couple things here and there, not a lot, just like 2 or 3 things. We thought that'd be funny because we knew what this friend was like. She comes downstairs. She doesn't really look around the room. She just walks downstairs. She stops immediately and says, something's different. And it took her about 5 seconds to realize we had moved like 3 things in her living room. So she had very heightened level of situational awareness, okay? Another great example, in the clinical setting, I was precepting a new nurse. Well, he wasn't actually a new nurse. He had worked on the floor for a little bit and then he was coming into the ICU. And in the ICU, there's a lot of sounds. There's monitors that make sounds, there's ventilators that make sounds, there's the beds make sounds, the compression devices make sounds, dialysis makes sounds, lots of noises, okay? So this preceptee that I was teaching and mentoring, we go into the patient's room early in the morning, we're about to do our first assessment, and it suddenly starts hailing outside, which is really uncommon where I live, by the way. So it was a weird sound. It was like not something you would expect to hear. And he immediately turned and looked at the patient. Like his situational awareness was so heightened that if he heard anything abnormal, he was going right to the patient. And that was perfect. I was so proud of him in that moment. Even though it was hailing and it had nothing to do with the patient, that's where he went, okay? So having that situational awareness, and that's going to help you stay hyper vigilant, hyper aware in the clinical setting. And when you're in simulation, noticing what's going on. Simulation is really fun, but for students, it's super stressful. You're in this, brief moment in time when you are, you're in this simulation, and simulation time is very precious. There's not, unlimited amounts of it. It takes a lot of work to put a simulation together. And so you might have 20 minutes in the simulation room and you want to learn and get as much out of it as possible. So it's just a little high stakes environment. Your professor's watching, your classmates are watching, everybody's there. You feel like you're being judged about everything. And when you have really good situational awareness, you can really take everything in. And this helps you as you get through school, as you become a nurse, you have that awareness and you start, I call it developing your nurse spidey sense. You start getting to where you can sense when something is off with your patient. So having that ability is really, really key. It's, notice next time you go somewhere you've never been before, notice how as you're getting there, driving or walking, you're paying very close attention to absolutely everything. And then when you're driving home from work or school, you're not paying attention really, and you get home and you're like, how did I get here? That's kind of the difference between being super aware and then kind of going by rote. So I want you guys to stay in that heightened level of situational awareness and self-awareness as well. Okay, the fourth thing, oh my gosh, I've got 12 of these, you guys. Okay, the fourth thing is ownership. Now this is perfect training for the job because nurses take ownership of your patient. When I'm taking care of a patient, that's my patient. I am super possessive of everything that happens around that individual. So as a nursing student, you can take ownership of your education, your clinical experiences, your homework assignments, all of it. You're gonna get out of your homework assignments what you put into them. You could do them halfway, or you could do them full tilt and learn a lot more. In clinical, I'll be honest, there's a lot of times when there's nobody around, overseeing you. Your clinical instructor might be off working with another student. The nurses are all busy. You could probably just go sit in the break room and nobody would know. You're not going to do that though. You're going to take ownership and get out there and learn as much as you can from it. So this kind of dovetails in with resourcefulness, but in nursing school, it's kind of, I'm not going to say trial by fire, but kind of. It's intense. And the instructors want to see that you can handle that intensity. They're not going to be spoon feeding you anything. They're going to tell you what you need to know, and they're going to expect you to show up on time. They're going to expect you to show up prepared and ready to participate. Okay, so taking ownership of all of that is absolutely key. Okay, so attention to detail, number 5 of our 12. Really, really, really important, you guys. Attention to detail is absolutely key. So, like looking at an exam question, one word can change everything, okay? An assignment for school, one sentence could change how you do it. When you're in clinical, one lab value could make the difference between your plan of care, doing one thing or doing another. So you have to have really, really good attention to detail, okay? If you find that you're missing exam questions or you're losing points on homework assignments because you didn't read that right, you really need to work on your attention to detail. And you can totally do this. So a great tip for developing that skill is as you're reading the assignment instructions, or even an exam question if you're able to, bring anything in with you, highlight the key terms, underline them, whatever it is, so that you are forced to really pay attention to them. Okay, so that's what I do when I'm reading through the assignment instructions, especially if it's when I was in graduate school, there were some really convoluted assignments that I had to do. And so I would highlight the key terms so that I had it straight and I did it correctly. So having that attention to detail, and then, working in a critical care environment, absolutely have to have that as well. Okay, perseverance is number 6. Nursing school is really hard. A lot of you might be in my Thriving Nursing Students group, and a lot of the talk lately has been about how a lot of students are really tired. A lot of students are barely getting through these last couple of weeks. They're doing it, and a lot of them are kind of surprised that they were able to even do it, but they're worn out and they're exhausted. So nursing school, I think it really does prepare you for the job, because the job is really hard most of the time. Some environments are less strenuous than others. Most of it, though, in the inpatient setting is really, really hard, you guys. So there's really not any way for me to describe how different it is from clinicals. It was the biggest shock I've ever had in my life, to be honest. But perseverance is absolutely key. So, for example, I was taking care of a patient who had a massive GI bleed, and she's basically dying right in front of me. She's bleeding out. And, but we fixed her, we saved her. Spoiler alert. So we went down, I had to go down with her to interventional radiology as we are doing a mass transfusion, pumping in, 4 units of blood by hand to get it in as quickly as possible. Interventional radiology, they use x-ray, so you have to wear lead. So I had to wear a bunny suit, which is what we call those white coveralls, PPE. It's a bunny suit to go into a surgical area. And then lead on top of that, gloves, goggles, the whole bit, you guys, because I'm standing in there with her, squeezing in all this blood and doing all of that and monitoring her. I'm sweating my tuchus off. It's like dripping down my body. I can feel it. I'm standing in there for like an hour. I'm scared to death for this lady. I've never been so stressed in my entire life, and I wanted to be anywhere else in the world. But perseverance. Sometimes you have to do things that are really hard. Nursing school is one of them, and standing in IR in a full bunny suit and lead while you hand pump in a bunch of blood on a dying but didn't die patient is another. So perseverance, if you are the kind of person who starts things and then stops when it gets hard, evaluate that about yourself and see what you can do to get through that, okay? Because you're going to need that strength in order to get through school, because again, it's a process, you guys. Okay, assertiveness is number 7. You have to be able to speak up. Now, no one ever believes me when I tell them this. I'm super shy, okay? I used to be so shy that I couldn't even call and order pizza over the phone. Like, I could not even call and talk to a stranger on the phone. I got through that, but I'm still really shy. No one believes me. But anyway, my point is, you have to be assertive enough that you can speak up for patients. As a student, you're going to be speaking up for yourself in a lot of cases. So you need to work on assertiveness if you find that that's challenging for you. So how I got past it, more or less, is I got a job as a waitress way back when I went to college the first time. And if I wasn't outgoing, or at least pretending to be outgoing and chatty and talk to strangers, I didn't make any money. So that really helped me learn how to at least talk to people I didn't know. And then my assertiveness as a nurse just came about because you have to call doctors and pharmacists and physical therapists and dietitians and other nurses and bed control and all these people all day long to get what you want for your patients. So you get really good at it. So if that scares you, start trying to work on speaking up. For example, let's say you go to Chipotle and you ask for a Diet Coke and they give you a regular Coke. Speak up for yourself. Get your Diet Coke. Little things like that. Baby steps, you guys. You have to be able to put your own fear of having your feelings hurt aside, because it's not about you. In the clinical setting, it's not about you, it's about the patient. So that's what helped me in the beginning. Was I would be like, well, I'm scared to call the doctor, it's 2 a.m. But if somebody else needed me to, like my patient, I'm going to call, okay? It's for them. So, you will get yelled at, big deal. Big deal, right? The first time I got yelled at by a doctor, I was like, well, that's done. That wasn't a big deal. And now I don't even care. If they're cranky with me, I don't even care. I get what I want for my patient, and that's what matters. Okay, so assertiveness, very, very important. Assertiveness, another time that you'll need it in nursing school is when you're leading a group project. A lot of times people don't do what they're supposed to do in a group project. And you have to be assertive about that. Or maybe you need to give people assignments, or you're in simulation and you're kind of leading the mock code or whatever the situation is, and you're telling people what to do, being assertive. Okay. All right, a thick skin kind of goes along with that. If you are the type of person whose feelings get hurt very easily, then working on having a thicker skin would be helpful. The best advice I can say for that is typically, like for instance, let's say you're in clinical and somebody barks at you. Okay, it's not about you. So that's what you have to do. You have to take yourself out of it. It's not about me. This is about them, and I can only control my reaction to them, and I'm not going to give them that kind of power to make me feel bad. I'm just going to go on and do what I need to do. So working on that, okay? Number 9, ability to make decisions, weigh choices, and consider the consequences. And if you are the type of person who's really good at making decisions, awesome. You're going to be making a million decisions, especially in the clinical setting, all the time. So that's a key component to being really good in the clinical setting. Remember earlier when I said the question you probably should be asking the most as a nursing student is why. The question you're going to be asking the most as you get more experience, you get some clinical experience, is what am I going to do about it? You're going to see problems, and I want you to ask yourself, what am I going to do about it? How am I going to help this patient in this situation? As I've said 1,000 times before, the job of a nurse, if you weren't sure what it entailed, it's seeing problems and fixing them. So it's noticing, and then it's doing something about it. It's also knowing what problems could occur and trying to avoid them. So that's the whole job, you guys, in a nutshell. Okay, so think back to, the last time you had to make a tough decision. How did you go about that? What was your decision-making process? If you're able to pull in a lot of data, filter it, analyze it, and then apply it to a situation, you're going to be great in the clinical setting. Okay, number 10 is a sense of humor. Okay, so this one's a fun one, right? So when you're uncomfortable, when you're tired, when you're frustrated, when you're overwhelmed, sometimes one of the best coping mechanisms you can have is to just have a sense of humor. Nursing school can be really fun if you if you can laugh at yourself, because you're gonna make mistakes, and sometimes you just have to laugh, right? It's laugh or cry. I will say that as a nurse, I've never worked with a more hilarious group of people in my life. Everywhere I go, every unit I work on, the nurses they're fun and they're funny. So having a sense of humor is great. We use it as a coping mechanism, a positive coping mechanism that just helps us get through the day. If you can laugh at the absurdity of life, if you can laugh at the absurdity of yourself, if you can laugh away the stress, you're going to feel so much better about everything. So if you have a sense of humor, nursing school will be a little bit less painful for you. Okay, and then number 11 is you need to have a really good blend of confidence, but being humble. So there's a fine line between being confident and being cocky and a know-it-all, and nobody likes that know-it-all person. But I do want you to be confident, but I want you to also know and have that self-awareness that there's a lot that you don't know and that you are eager to always be learning, okay? When you guys graduate, you will have probably the most book knowledge that you will ever have in your entire career, okay? It's astounding. I look back at the stuff I knew when I took my NCLEX and I'm like, holy cow, I learned a lot in nursing school. And then, if you don't, work in that specialty or whatnot, you just kind of lose that and you don't need it because you're not working, say, with neonates or whatever. But then when you come into the clinical setting, even though you know a ton of book knowledge, you're gonna be a little shell-shocked at what you don't know and how much you learn every single day. I am humbled daily by what I learn in the clinical setting, and I've been doing this for almost 10 years. So having the confidence to go in there and take care of a patient, that's huge, but also the humbleness to know that you don't know everything and there's so much more to learn. And that's why it's such a great career, because you can always be learning something, okay? And then number 12 is good coping mechanisms, you guys. We talked a lot about mental wellness, mental health wellness. Was that last week? I can't remember. It was a little bit ago. I just cannot stress this enough, how imperative it is that you have good and healthy, positive coping mechanisms, because there will be times in nursing school and on the job when you don't feel so great about things. So how do you cope? Do you, when you're stressed, overwhelmed, what have you? Do you freeze up? Do you panic? Do you do avoidance behavior? I always cleaned the house when I didn't want to do something. So I don't know if that was a positive coping mechanism. I think it was a little bit, even though I avoided the thing I didn't want to do, my house got clean and then I was able to come back to it fresh. For some people, it's exercise or just taking a break and doing something kind for yourself. So paying attention to what your coping mechanisms are, because if you deplete your well, as we say, you won't have anything left. And this is a marathon, you guys. Nursing school is a total marathon. It's not a sprint. So you have to pace yourself, okay? So that is it. That is my 12 most significant personality traits that can set you up for success as a nursing student. So I'm sure you recognized in that list at least one thing that you're like, yes, I know that is true about me. So I do want to let you guys know that my course is on sale right now. Somebody had emailed me thinking it was only on sale for one day. It's went on sale December 8th. It's on sale through January 10th. So if you're starting nursing school or you're a student who struggled in maybe first semester and you need a redo, a reset, this is the course for you. It's called Crucial Concepts Boot Camp, and it's on sale right now. And that sale goes through January 10th, but for the first few days, you even get an extra bonus when you enroll before December 13th. You get a free study guide on electrolytes. So that's great. I will link to that. You can go to my website, straightAnursingstudent.com. You can find it from there. I will link to it as well. Or please send me a message. I'm always happy to connect with you guys and answer your questions about that. So does anybody have any questions about first semester or anything that I talked about here before I head out? I'm just gonna scroll through and see who all is here so I can say hi to you. Hi, Sarah, while I wait for questions. Hello, Erica. Hi, hi, hi. Hi, Brittany. Hi, Karen. I feel like Romper Room. Did you guys ever watch that show? Jessica, I think I recognize your name. I feel like I've seen you here before. Lena, I definitely know Lena's name. I feel like we've emailed or chatted before. Gabriella, that's a beautiful name. Hi, Gabriella. Hello, Bree. Yes, Monica, I see you were commenting on the group projects. Absolutely, you have to be kind of bossy. About group projects, you guys, don't always take on the leadership role. Don't make the mistake I did. Don't. Just let other people have some of the fun. That's no good. Hi, Terry. I'm glad you're here too. There's Rachel, Mary, Louisa, Nicole. Okay, lots of new names. I'm so glad that you guys are here. There's Jordan. I see Jordan a lot. Hi, Jen. Okay, very good, very good, very good. Okay, so if nobody has any questions, I'm gonna head out. Tomorrow, I'm going back and forth on what the topic is tomorrow. I think it'll be game time decision. So I'll be back tomorrow at let me tell you what time. 12:30. 12:30 tomorrow, we'll be talking about something interesting about nursing school and how to prepare and get into the right space for that, okay? So I will see you guys again soon. I'll put info in the comments, and if you have any other questions, absolutely reach out anytime. Okay, thanks. Bye, guys.